Director of the Global Fund, and Dr. Monique Vletter, Head of Health, Nutrition, and Population at the World Bank, along with our moderator, Anil Soni, CEO of the World Health Organization Foundation, for panel discussion on unlocking climate financing for local health adaptation.
Hi, everyone. The three people to my right represent almost exactly embodiment of the three recommendations in the report released today. Yassine, given your work of Speak Up Africa in Senegal, I'm going to ask you to speak a little bit about what it means to break silos. What does it mean for local stakeholders who are closest to the challenges and the solutions to have voice in decision-making and governance? How do we make sure you and the people you represent are at the table guiding the funding decisions? And I'm going to go through each of you so you can take a second to think about that. Peter, as the Executive Director of the Global Fund, which is the world's largest financing mechanism for infectious disease, I think the second recommendation of bridging capacity gaps, how do funder requirements be adapted to meet the needs of climate and health and to push more money to local solutions and local stakeholders, is one that I'm sure you're thinking a lot about. So I'm going to come to you to ask you about that and how mechanisms like the Global Fund are adapting to the needs of the moment. And finally, Monique, I'm going to come to you on the third recommendation. Really, the panel makes it very easy for me as a moderator. on building new funding channels, developing and scaling dedicated funding mechanisms for locally led adaptation. So we have the fund, to Monique's right, and that's important. But the figure in the report, and that we're all talking about, an annual gap of $366 billion for climate adaptation, is well beyond the scope of official development assistance, is well beyond the scope of philanthropy. So the question, Monique, I'm going to come back to you, is say, how do we bridge the gap, particularly given what the World Bank and regional development banks can do? In each case, for the benefit of the audience, we're going to ask each of you to give an example of what's working relative to that recommendation. So give us some hope, tell us where it's working now, and then help us understand what the gaps are. And given this audience, which is spectacular, what do you need from the people in this room? So Yassine, starting with you, coming back to that first recommendation, breaking silos, how do we make sure local stakeholders are part of the process or at the table? What's working and what more do you need?
Thank you so much, and thank you for having me here. I think what's working is what's happening right now, is having communities at the decision-making tables and part of these important conversations that are happening around shaping the global agenda. If we don't have that, then we are not able to serve the communities that we want to be serving and that we all agree are the priority of everything that we do. I think in terms of breaking the silos in countries, it's also important to have the appropriate mechanisms in place. So looking at ensuring that there's units within cross-ministerial, across sectors, including civil society, youth, and others, that are able to work on the national strategies, including the national adaptation plans, that they have a voice and that we are able to reflect the local realities. I think for me, that's the biggest challenge, is today there's a disconnect sometimes between what happens at the global level, at the regional level, at the national level, and then even within country, there's a disconnect between what happens in the health sector, what happens in the climate sector, and what happens in other sectors. So really trying to see how we bridge those silos is critical and
Can I
key.
double click there for a second? The Global Fund is an example of a mechanism in the health sector that requires civil society to be at the table. But in order to solve the challenges of climate adaptation, we have to look beyond the health sector. Can you give us an example of where local stakeholders are part of the decision-making progress beyond the health sector, with a Ministry of Finance thinking about allocations of resources for other sectors?
So I think I was also going to give the example of the Global Fund, because I do think it is a mechanism that can be used to include these other priorities. I think the country coordinating mechanisms work well, are well established. And so if we can ensure that the priorities, from in terms of what we're trying to achieve with climate adaptation, are included within that, and I know Peter will be speaking a little bit more about that. And then, there are within the presidency, for example, of Senegal, there's someone who's specifically responsible for all health issues, including how they intersect with other areas. And so that could be a mechanism that could be further developed to be able to have that engagement from all sectors.
Last question, Yassine, for you. Looking at this audience, what more do you need? What are your requests of the people in this room who have power and privilege to implement this first recommendation on breaking silos?
So my request is really to be intentional about including communities in all the different levels of decision making and really ensuring that there's a co-creation process at the beginning. And not once everything has been agreed upon, then we bring in the communities. And I think it also has to go beyond representation. So to truly take into account what the communities need. And, that also brings the issue around power imbalance. So really being conscious that there is a power imbalance that exists. And so how do we put in place the mechanisms that will allow for that power imbalance to balance out and to be really inclusive of everybody.
Thanks, Yassine. Peter, your leadership of the fund, you've had to adapt the fund to be responsive to pandemic challenges, response and preparedness, now climate and health. How are you adapting the fund, you and your team, to the needs of climate and health, including the needs to put more money into the hands of local stakeholders?
Right, well, let me start with some of the things that, in a sense, are okay or going well. One good starting point is that of the $5 billion or so the Global Fund invests every year in health, 70% of it goes to countries that rank among the top 50 in terms of climate vulnerability. Now, that's not because we had great foresight about which countries would be most climate vulnerable. What it actually reflects is that the people who are most vulnerable to infectious disease also happen to be the people who are most vulnerable to climate change. So that's really a bad thing. These are the people who are being impacted by the kind of double whammy of both. But what it actually means, the good thing is that we are already focused on those communities. I do think we can use, and we are using, established mechanisms, the country coordinating mechanisms, the inclusive decision making in those responses. And one of the things that was quite interesting to us was that in the last grant cycle, in the funding requests, 40% of them included components related to climate change. And we really hadn't asked for that. It was coming from the countries themselves. And that, to me, is an indication of the system itself working. What isn't working? Well, there isn't enough money. Let's be clear, on malaria, which is one of the most climate sensitive diseases and where the epidemiology is being changed quite dramatically, there isn't enough money in the first place, even before climate change. And we're not going to solve the problem by just diverting money that wasn't enough before. So we are going to have to raise more money. And one of the things that actually just happened at the end of August, the Global Fund Board approved climate and health as a catalytic priority, which means we can go and raise money specifically for that. And as you might guess, we are doing that. We are very actively doing that because where we sit at the moment, even though we are investing in flood resilience, because we're spending a couple of billion a year on health systems, we're investing in things like flood resilience, disease surveillance, linking meteorological data, making supply chains more flood resilient. It's not enough. We have about 400 to 500 million right now in specific requests from countries for climate-related investments I have no money for. So we need to go out and get more. Reflecting on some of the key barriers, apart from the insufficient funding, which is pretty obvious, local knowledge undervalued. I actually think we are going to have a very inclusive to and fro process as we adapt. There's a lot of questions about the impact of climate change on health none of us know the answer to. And we need to be real-time learning. We can't wait to act, but we've got to be real-time learning as we act. I do think the thing about power imbalances is incredibly important. I thought the global health world was a technocratic, top-down world. Then I met the climate change community. The climate change community makes us look very sort of inclusive. We do need to ensure the voices of communities, and not just the voices, but the leadership and the active engagement runs through the whole process. And then complex processes. The one thing I can promise people is if they want climate change money through the Global Fund, it will be exactly the same complex processes, but at least they're not new complex processes. We are running all our stuff on climate change through all our existing reporting assurance and things, because we know that the last thing countries need is a completely different set of things. Last thing I would mention is one part of it is about preparedness and resilience of systems and anticipation. The other part of it is about responsiveness. We have been using our emergency funding more than we ever anticipated because of the frequency of floods and cyclones, flooding in Kenya earlier this year, the flooding in the Sahel right now. And this money can arrive very, very quickly and is useful. However, to my mind, we should be learning from the fact that if you're using emergency funding for the same kind of thing all the time, then you're kind of missing the point. There's a pattern here, and there's a bigger problem that we've got to solve, and that is why our board has decided to make this a focus and a priority.
Thanks, Peter. You mentioned in the emergency funding something that comes up in this third recommendation. And Monique, now let me come to you. But this third recommendation, it is once again a important list of where else can the money come from. Emergency response funds, catastrophic insurance, innovative finance. But ultimately it comes down to how do we bridge something of this enormous gap of finance. Monique, you're at the World Bank. Your capital can be used differently, and that of the regional development banks than ODA, than grant capital. Help us understand what you're doing to bridge this enormous gap of capital finance.
Great, thank you so much. Really great to see this kind of interest in this important topic. Maybe I'll say a few words about the shift we've been making over the last 2 years at the World Bank, and then talk very concretely about some country examples so that you can really visualize how we see the climate and health agenda moving forward. And so our president, President Banga, came in 2 years ago and made an important switch, and it might seem minor to you, but he added the language to our vision statement. And instead of saying our goal is a world free of poverty, he said our goal is a world free of poverty on a livable planet. And that actually led to very major changes in the way we organize our work, how we focus, and also in terms of our financing. And so he then set the goal that 45% of all World Bank financing, not just for health, but for all sectors, should be climate related. And we really in the health sector saw that as the opportunity to say, well, in actual fact, this is a systems agenda. It needs an integrated approach, and we want to take the portfolio of programs that we have and our collaborations with 110 countries in the health program of the World Bank to go through this transformation and ensure that everything we do on health takes into account climate as a factor. And so how do we do that? And I just came from 3 conversations with 3 different country ministers, very inspirational: Sierra Leone, Mozambique, Nigeria, all struggling with the same issues. And we start with working together under country leadership, to do an assessment through a diagnostic tool that we developed of what is the biggest impact of climate on health, and it's very, very wide ranging, right? It's not just extreme weather events. We are seeing outbreaks of cholera. We're seeing increases in other diseases. We're seeing a real pressure on health workers to be able to be responsive, but we're also seeing people struggling to access services because they need more of it, and they don't have the financial resources, and they're making really difficult choices between buying food for their families or buying medicine or accessing services. And so it's a wide-ranging agenda, and for us we can only fully respond if we ensure that the work we do on primary healthcare reform, on financing, on human resources fully takes into account the impact that climate is having on health. It's also a multi-sectoral agenda, and so, for example, the 21 countries that are struggling with waterborne disease outbreaks because of the changes in temperature, you see these outbreaks happening in communities, in those communities that are most marginalized, and also don't have access to clean water. And so in collaboration with WHO and with our water colleagues in the World Bank, we can actually target the water finances resources towards those communities that are most affected in their health outcomes because of climate. And this is just one example. There are many other examples of how we sort of leverage that multisectorality across the bank. And I was very inspired listening to our first panel member here. I really fully agree. When I think about country leadership and voice, we have to take full country voice into account. And I want to finish with making one more point there, that it's really not the same for all people, right, the impact. And so if you look at the impact on women, if you look at the impact on poor people versus rich people, it's not the same. And so in how we design and how we use our collective leadership, we really need to take into account that these resources first and foremost need to be focused on those people most in need. Thank you.
Thanks, Monique. We're going to finish up, and I know we're short on time. I'm just going to end by reflecting back on something Peter and I were talking about before we walked in, which is what's the effort to outcome ratio of meetings like this. Many of you are not living here in New York. You've come to New York for this week. You attend sessions. You speak at sessions. I think it's incredibly important, as Monique just ended, to say, if you have not seen with your own eyes, or if you are not someone who lives in a setting in which this is happening right now, please trust it is absolutely urgent. I was back in India for the first time since the pandemic a few weeks ago, and I met women who live in Gujarat where the temperature inside their homes is exceeding 50 degrees. Already. And thankfully, there's now an insurance product this year. 50,000 women had access to cash payouts when the temperature hit a certain level so that they could adapt. But that's 50,000 women out of billions of women who are affected by climate today. So this is urgent. And so my challenge to each of you is, one, hold people in power accountable, including everyone on this stage. And second, make your own intention, as you've seen that beautiful word that you used, of what you're going to do differently this week, because it is urgent, and it is the time right now to act, as we heard earlier. Thanks very much.